Macular degeneration is actually an aging disease of the eye, and it's caused when the cells in the retina, in the central part of the retina, begin to eventually waste away. And when that happens, people can eventually lose their eyesight from this disease. Yes, actually there are two forms of macular degeneration. The first form of macular degeneration is what we call the dry form, and about 90% of our patients will develop this form of macular degeneration. And what happens in the dry form of macular degeneration is that the cells that are responsible for our central vision eventually lose the ability to dispose of their waste products in an efficient manner. So the waste products build up and prevent the cell from functioning normally, and eventually the cells die one by one, and as they waste away, eventually you lose your central vision in a very, very slow manner. The other form of macular degeneration is the wet form, and this is by far the most devastating form of macular degeneration. About 10% of our patients with the dry form can convert into the wet form of macular degeneration. What happens in this form of the disease is that the body does recognize that there's not enough nutrition getting to the retinal cells, that the wastes aren't getting out fast enough. So in an effort to heal the area, the body tries to grow new blood vessels. Sounds like a good idea, but it's actually very devastating to the eye, because what happens is these blood vessels are extremely fragile and they can break very easily, and when they do, there's a sudden massive hemorrhage in the central portion of the retina. Blood is extremely toxic to the eye. The cells die immediately and you lose your central vision. Unfortunately, in the early stages of macular degeneration, there are no symptoms. We can start seeing these waste products building up in people's eyes. The signs are very evident, but people will not have any idea that they have any problem with their vision. They can still be seeing 20/20, in fact. However, as the disease progresses, in the dry form of macular degeneration, they can start noticing that their vision is perhaps a little blurrier, they're not seeing as well. There might even be little, maybe pieces of vision missing or not as distinct. If they do progress to the wet form of macular degeneration, their vision will become distorted, and then eventually quite large pieces of vision can disappear, till eventually in end stage of wet macular degeneration, no vision at all, at least centrally. Mainly anybody over the age of 50 is at risk for developing macular degeneration. It is an age disease, the disease of the elderly. There are some factors that we cannot be responsible for, things like having light-colored eyes, and again, family history of macular degeneration. But there are factors that are within our control. For instance, people who have high blood pressure are more at risk, obesity increases the risk, smoking definitely increases the risk of getting macular degeneration, and as well, if you have a diet that's very poor in leafy green vegetables, that does not have enough antioxidants, you don't eat enough fish, products like that, you again are at higher risk of developing macular degeneration. Actually, the good news is macular degeneration is extremely easy to detect in an eye examination. Any doctor, when they're looking inside your eyes, they dilate your pupils, have a good look inside, can see the earliest forms of macular degeneration starting right away. Well, the dry form of macular degeneration today we treat with nutritional supplements. There's a few different nutritional supplements that we use. One of them contains products called antioxidants, and the antioxidants help to quench or destroy things called little molecules called free radicals, which are produced in the retina in response to age and environment. Smoking, ultraviolet light as well can produce free radicals in the eye. The other is lutein, and lutein is a substance that you must eat. Your body cannot produce it. It acts as a kind of a natural filter inside the eye and helps protect the eye from ultraviolet light, which again is one of the factors that can cause macular degeneration. And the other is fish oil, and omega-3s or fish oils work by allowing the cell to repair itself if it does become damaged, reducing signs of inflammation in the retina, and also helping to prevent the growth of those new blood vessels that can bleed and cause a devastating vision loss. You can't change your family history, and you can't change your age, and you can't change having light eyes or light colored eyes, but there are a few things you can do to help protect yourself. One of the most important is to protect yourself from ultraviolet light, because we know that a lifetime of exposure to the sun and ultraviolet light accelerates this aging process in the eye, and that macular degeneration will happen sooner. If you're a smoker, you should absolutely stop smoking. Smoking increases the chances of getting this disease at least 7-fold. Also, diet is an important consideration. Most people over 50 are not eating enough fruits and dark leafy green vegetables and fish. So in most cases, we do recommend that patients actually take a supplement, and at the very least to take a multivitamin that has antioxidants in it that are good for the eye, and also the lutein, the pigment that we talked about. And in addition to that, we recommend that people take fish oil as a supplement, the omega-3s. About 1,000 milligrams a day is what's recommended.